Chapter 26, Outward Focused Emotions, Violence. Agitation is a behavior that is verbally or physically offensive. Aggression is a forceful attitude or action that is expressed physically or verbally. Abuse is an intentional misuse of someone or something that can result in harm, injury, and trauma. Violence is an outburst of physical force that abuses, injures, or harms another person or an object. Neglect is harm to another's health or welfare, either through a failure to provide for their basic needs or by placing their health or welfare at unreasonable risk. Exploitation. This is the use of an individual for selfish purpose, profit, or gain. Violence is a major cause of death and disability in most industrialized countries. The number of violent acts in the United States in 2017 was 1,247,321. The United States has the highest murder rate of all the civilized countries. The unemployment rate for young minority men in the United States is close to 50%, and this group also has the highest rate of violence. There are several theories that attempt to explain the nature of violence. Machismo is the compulsive masculinity. Feminist theories state that males are socialized throughout childhood to behave more aggressively and violently. The characteristics of a person with machismo. The individual has an attitude of male pride, engages in thrill-seeking behaviors, employs competition as a guiding principle, very self-centered, is unable to express emotions except for anger and rage, dislikes being gentle or vulnerable, values sexual virility, treats women as objects or commodities, sees women as objects of conquest, unable to cooperate with women, agrees to sexual use and physical abuse of women, uses aggression to physically solve problems. Domestic violence is defined as abuse and a battering within a family. Battering describes repeated physical abuse of someone, either a woman, child, or an elder, routinely. Victims of violence or abusive acts often suffer from post-traumatic stress disorders. There are characteristics of dysfunctional families. Individualism is not encouraged. Autonomy and trust are lacking. The family can appear chaotic, disorganized. Conflict is viewed as negative and is expressed through power struggles and sexual aggression. Family boundaries are rigid. Members feel threatened when outsiders try to enter the group. Further characteristics of dysfunctional family. Parents feel they cannot control their children. It is often unclear who is the parent and who is the child. Family members expect their own needs to be met. Individualism is not encouraged. The focus is only on the present. Family may confuse violence with caring. There are early signs of an abusive personality. A push for quick involvement. Jealousy. Unrealistic expectations. Isolation of the partner. Blaming others for problems. Makes others responsible for feelings. Hypersensitive. Cruel to animals and children. Verbal abuse. Rigid sex roles. Sudden mood swings. Threats of violence. It is difficult to believe that a father would intentionally harm the mother of the child, but trauma is the leading cause of maternal death during pregnancy. The frequency and severity of abuse and the potential for homicide are significantly increased for white women. Abused women of all races are twice as likely to postpone beginning prenatal care until the third trimester of pregnancy. Physical abuse is inflicted injury to a child, ranging from minor bruises and lacerations to severe trauma and even death. Sexual abuse is the intentional engaging of children in sexual acts. Sexual abuse can take the form of rape, incest, fondling, intercourse, or other forms of sexual contact. Emotional abuse may involve rejection, criticism, terrorizing, or isolation. Child abuse went almost unrecognized in the United States until the early 1960s. There are many examples of bullying behaviors. Physically bullying, choking, hitting, kicking, punching, pushing, tripping. Verbal abuse, hate talk, mocking, starting rumors, taunting, intimidating, teasing, threatening. Exclusion, encouraging others to stay away from the individual. Cyberbullying, the use of social and other electronic media to deride others through hate mail, mocking, starting rumors, threatening, and encouraging others to do the same. There are factors that may cause caregivers to abuse older adults. Caregiver burnout and fatigue, or lack of knowledge of the needs of an older adult. The various forms of elder abuse are physical abuse, neglect, which is either abandonment or confinement, psychosocial abuse, which is withholding decision-making power and affection, or social isolation, and exploitation, which is dishonest or inappropriate use of the individual's money, property, or resources. Sexual abuse is a devastating form of abuse, the unwanted sexual attentions of another. When sexual activity occurs between members of the same family, it is called incest. Sexually abused adults are most often women, and most sexual assaults are made by women's partners. The most violent form of sexual assault is rape, and it occurs more frequently in relationships associated with other forms of physical aggression. Acts of violence are becoming commonly accepted within the United States. Radio, television, and internet surround individuals with examples of violence, and children are using violence in tales of aggressive actions from the time they are first exposed to cartoons. Rape trauma syndrome. This is a related nursing diagnosis that encompasses the essentials of care for the victims of this violent experience. Crisis is a part of every violent act. An individual's usual coping skills are ineffective when dealing with the effects of violence. To recover, new coping behaviors must be found and then applied. Forensic evidence. This is information that is gathered for legal purposes. It is vital to remember that each diagnosis has many interventions. Aggressive and violent actions are often seen in individuals who are diagnosed with a mental illness. The treatment consists of assessing the risk factors, developing interventions to reduce aggressive reactions, and helping individuals learn better coping skills. The healthcare providers are less immune to acts of violence than in the past. It is important to remain aware that violence can erupt during any situation with a patient.